Okay. Hello, everyone. Welcome to Mom's Corner. I hope everyone's doing well today. My name is Zainab. Thank you so much to everyone for being here. For those who are regulars on Mom's Corner, thank you for coming. And for those who are joining us for the first time, welcome and thank you for being here. I want to just a brief mention that I will share the link to the stipend at the end of our meeting. So please make sure that the name on your screen reflects the one that we'll be sending the stipend to so that we have the right person. And if you need help in changing your name, I can certainly help you with that. Um, a brief introduction about Mom's Corner. Mom's Corner is one of the many programs under the umbrella of Global Perinatal Services, or GPS. And GPS is a nonprofit doing some amazing work in many communities and changing lives every day. Our organization's mission is to provide perinatal support services that include doula services, lactation education, childbirth education, early parenting support, and child development. The communities that we provide those services to are marginalized communities, which include Black, immigrant, and refugee families. And Mom's Corner is not just a space for moms, but for all women folk and supporters of women, because at GPS, we believe that motherhood is an extension of a woman's identity and not the definition. And Mom's Corner, since the pandemic, has become a space where we find empathy, support, camaraderie, and it's a safe haven and access to so many critical resources in our communities. And I want to mention that we will have a question and answer at the end of the session today, but if you are so inclined to ask a question or are curious or just wondering about something, please, we invite you to share. This is a safe zone, a judgment-free zone, and so all questions are welcome and encouraged. And just want to give welcome our great doctors again, and for having our doctors here again today. And we're so excited for this session about perimenopause and menopause. And so I will hand it over to you, doctors, without further ado.
Okay, can you guys hear me okay? So we're trying something, all three of us are actually in the same room at Claire's apartment, and we're just gonna use Rebecca's laptop for audio. So if there's any issues hearing, just let us know and we can do something different. Thank you for the great welcome, Zainab, and we are so happy to be here. My name is Sarah Hemphill. We are all, I'll let everyone else introduce themselves too, but we are all family medicine doctors at Swedish, and we love our partnership with GPS and are so happy to be here. Do you want to introduce yourself?
Yeah. Hi, all. I'm Rebecca Chen. I work at Swedish and also at the Downtown Family Medicine Clinic, and we're very excited to talk to you guys today.
Hi, I'm Claire. I'm sorry, we're sound issues. I'm a second year resident, and I'm really excited to be back. I'm at the Swedish First Hill Clinic.
Great, we'll go ahead and get started. So our topic today, like Zainab said, is about menopause and all of the many things that happen during menopause and also how it's treated. And special thanks to two doctors, Dr. Allison Ye and Dr. Rebecca Dunsmore-Sue, who both contributed to information that's on these slides. Dr. Ye actually presented on Mom's Corner the same topic maybe 4 years ago or so, and so we've adapted some of her slides. And Dr. Dunsmore-Sue is an OBGYN that we are connected with through Swedish, who also did a talk on menopause that we use some information from. And I'm going to try and make this interactive, and so I hope to hear from you all, and feel free to interrupt us at any time, but I want to start. We have a lot of information to share about menopause, but we really want to know what you all want to know about menopause and perimenopause and the whole process. So if anyone is so brave to mention a few topics that they're really interested in learning about today, we want to make sure that we get to those topics. And if we don't hear anything, that's okay. We'll just carry through, but I'll give it a few more seconds. Okay, that's okay. We'll carry on. So this is the outline of the talk. We're going to talk about what menopause is, what some of the symptoms of menopause are, the timeline of menopause, knowing that it's very different in every person, how we can treat menopause, and other resources to look for us or for our patients or clients that we're helping. I want to also give the caveat that throughout this talk, we may use the term woman and women to describe what menopause happens to, but just want to sort of acknowledge that lots of people who don't identify as women, like trans and gender diverse people, can also go through menopause. And so we also are talking about them when we're talking about all these things. So just to start, I want to start with kind of some of the physiology and kind of the anatomy that goes into what menopause is. So menopause is a very normal part of life for people who have ovaries. And what menopause really is kind of our ovaries reaching the end of their lifespan. And so towards the end of someone's reproductive life, the ovaries gradually stop making a hormone called estrogen as they kind of run out of eggs or follicles, which are the cells that kind of can make a pregnancy. So over time, ovulation, which is the process that ovaries release egg cells, sort of stops happening because there are fewer and fewer egg cells. As that happens, there's less and less estrogen produced by the ovaries, which causes various things. Other hormones like progesterone doesn't get produced, and that's one of the things that really leads to menstrual cycles or like shedding of the uterine lining. And the uterine lining itself doesn't thicken, so we stop getting our periods. So those two changes in hormones really contribute to period stopping. But the loss of estrogen over time is the primary thing that leads to all the symptoms of menopause. So what are those symptoms of menopause? I've covered up kind of the meat of the slide, and I want to hear from you all if you wouldn't mind sharing symptoms that you've heard of, or maybe you've experienced if you've been through menopause or perimenopause, what the very common symptoms of menopause can be as a result of these low levels of estrogen. Does anybody know any of them?
And feel free to share in the chat as well, guys. Hot flashes is one of them.
Yeah, great. Hot flashes is one of the more well-known ones. Maybe see people with fans on themselves when they're going through hot flashes. You might also hear of people getting night sweats at night, which is just when the hot flashes happen during the night, and can be really disruptive to sleep. Any other symptoms that you all have heard of?
Like you're having a heart attack.
Yeah, sometimes that can be the sensation during the hot flashes. The chest pain is not a common symptom of menopause, so if you're having chest pain, I would say go talk to a doctor because it might be something else. But that's a great thought. Any other ideas? Okay, well, I will reveal some of the other ones. So hot flashes is one. Like I said, the hot flashes at night can cause major night sweats. You know, people can wake up drenched in sweat and have to change their clothes in their bedding, and can be really disruptive to sleep. And then also just menopause itself can also cause insomnia and have trouble sleeping. Mood swings is a really common symptom of menopause. And it has to do a lot with the fluctuations in hormones and the loss of hormones. A really common one that people really rarely bring up to their doctor, which we wish was not the case, is vaginal dryness, which can cause discomfort, pain with urination, and pain with intercourse. And there's lots of ways to treat this, which we'll talk about. And so if this is something that any of you ever experienced, please bring it up with your doctor because we really want to talk to you about it. And there's lots of ways to make it feel better. Sexual changes is really common too. So loss of libido, less interest in sex, and more trouble having sex when you do have sex. And then cognitive changes, people can experience things like brain fog, memory problems, fatigue, and that's all really common and a normal part of menopause. And there's also lots of ways to treat that. And then joint pains is another pretty common one. So here is just a little graphic with the same information. Next, I want to kind of go through what the stages of menopause is, and I will also present the caveat that this is different. This is different in everyone, and that the specific ages that this happens at can be very different. On average, in the US, people sort of are at menopause by the age of 51. That's like the average age, but it can be anywhere from like 40 to 55 or even 60. And so the period leading up to menopause, and we define menopause, there's like a one point in time that we say this is menopause, and that is when someone has gone 12 months since their last period. And so a lot of the times toward leading up to menopause, the periods will kind of get more irregular and have a longer amount of time in between each period. And that's what we call perimenopause. But until someone has had no periods for 12 months, they are not yet menopausal. There is another sort of entity called premature ovarian failure, which is when someone might go into menopause earlier than the age of 35. And so that is something, if you are ever concerned that you have stopped having periods and you're not close to that age of in your 40s, to let your doctor know, because there's some more testing that can be done. And on average, the perimenopausal period, so sort of starting to have irregular periods, starting to have some of those symptoms of menopause, usually starts in the mid-40s. So 47 is the average. So we'll talk a little bit more about this, but there are some sort of long-term health consequences of menopause and having that decrease in estrogen, including loss of bone density. And so osteoporosis is something that y'all may have heard of, and that's related to the loss of estrogen because our bones need estrogen to maintain sort of their strength. And so over time, once people have gone through menopause, they do lose bone strength. Cardiovascular disease risk. There's kind of a lot behind that, and it'll be too much to go into for this talk. But one way that I like to think about it is you may or may not know that like men or people with testicles tend to have more cardiac events like heart attacks and strokes earlier in life than women. And the reason we think for that is that estrogen that people with ovaries has is actually protective against those things. And so women tend to live longer and have fewer heart attacks or strokes until later in life. And so we can think of estrogen as like protecting against those things. And once someone goes through menopause, they kind of start losing some of that protection. People have skin changes, they have trouble balancing, and then the loss of estrogen can also kind of cause changes in where body fat distributes in their body. And so where body fat used to go to like the hips or the buttock can, as people get older, sort of tend to be more in the stomach and the middle of the body. But we're not going to go into the weeds on all that stuff. So Rebecca's going to take over and talk about how menopause is treated.
Sure. The treatment of menopause really depends on your symptoms and what's most bothersome to you or what you think would be the most beneficial to get some relief from. There's lots of different treatments out there, both things that you have a prescription for, so medications that are hormonal or non-hormonal, and things that you either just apply in one area, like a topical ointment, or a systemic form, so a pill that goes through your whole body. And then there are also supplements, which we'll talk about briefly as well, and behavioral modifications. So like the fans for hot flashes is one good example that a lot of people use and incorporate in their life. We'll first start by talking about hormone therapy. Estrogen has been shown to be the most effective treatment for relief of hot flashes and other menopausal symptoms. And this makes sense because estrogen is the hormone that is being depleted in the perimenopausal, menopausal state. So you're not having as much estrogen in your body as you used to. And estrogen is available in many forms here in the US, both oral, so pills, or transdermal, like patches, topical gels and lotions, and also vaginal rings. And then progestins are a man-made hormone of progesterone that are also in different forms, oral, vaginal, and an intrauterine device, which is used right now as birth control, but can also be used for symptoms of menopause. And right now for hormone therapy, all women with a uterus need progestin as well as estrogen for combined hormone therapy. The risks of just doing one form are too high, so that's why we recommend that you have both whenever you start hormone therapy. The benefits and risks of hormone therapy we'll just go into in brief here, but definitely worth discussing with your doctor if you're interested further. So the bone health is a really important one to think about. You might have heard that women are more prone to falls and bone fractures later in life, and there is a higher risk of osteoporosis in women or people with ovaries because of the not having the protective effect of estrogen and kind of building up that bone. So hormone therapy would prevent against bone loss, but it can't rebuild bone if you already have osteoporosis. A benefit of hormone therapy is also of preventing hot flashes or reducing how many hot flashes someone would experience. Cardiovascular health, again, if especially effective if started within 5 years of the last period, so within a few years of when you're officially in menopause. Also, some reduction in the risk of type 2 diabetes and help with mental health because depression is really prevalent during perimenopause and menopause. Hormone therapy has been shown to be as effective as an antidepressant like a SSRI or a different treatment for depression as during perimenopause. And some of the risks, there was concern about risk of breast cancer with starting hormone therapy. Right now, it's been shown to be very safe, and that risk is considered pretty low by most health professionals. There is a risk of blood clot, and that risk is with starting any hormone therapy. So even with oral contraception or anti-contraceptives that people take like as pills for birth control earlier in life, there's always a tiny risk of blood clots. And then that risk of endometrial cancer, which is why earlier we said we recommend estrogen and progestin both to be used. There's very few contraindications to hormone therapy, even though there's all this text on this slide. These are pretty rare reasons that we would not recommend someone start hormone therapy. If someone has a history of breast cancer, especially if they have the BRCA gene or are at high risk for an aggressive form of breast cancer, then this would be a contraindication to starting hormone therapy. If they've had a previous clot or a venous thromboembolism or a stroke, then that would be a contraindication to starting it because of that small increased risk of having clots. And then if there's liver disease, increased vaginal bleeding that's unexplained, already having endometrial cancer, especially high risk cancer, and then having a high, what we call ASCVD risk, which is a high risk for stroke. And this is based on a large study done in 2002 that was really demonstrated mostly in people older than 60. So while this study did show these effects, if we start hormone therapy earlier, the medical community thinks that a lot of these effects will be mitigated and will not be as dangerous. So most women right now who are seeking medical therapy for menopause symptoms do so in their late 40s or 50s, and that would be a very safe time to start this therapy. The types of hormone therapy are, again, the combined estrogen plus progestin, and these come in a lot of different forms. The most common one is probably the birth control pill, which is also called oral contraceptives, OCPs. And then a patch or a ring that you can apply on your body for the patch and then in the vagina for the ring. There are some progestin-only pills, which are not as common probably for hormone therapy, and then an IUD as well, which would be safe to use, but is currently an off-label, so not used as commonly as the combined pills. There's also topical vaginal estrogen, so like a ointment or a cream that you apply in the areas that are dry and uncomfortable. And this is not contraindicated if you have breast cancer, so it's safe in people who might already have cancer because it's just applied in that one area and isn't absorbed in your whole body. If patients don't want to use hormones, there's a lot of other options. So there's medications that do not contain hormones. There's also supplements, behavioral modifications, and other methods that might include some of the behavioral modifications and other things. The non-hormonal medications that we most commonly prescribe are antidepressants, SSRIs or SNRIs, and one example is this paroxetine that you see. This is the only one that is FDA approved, although a lot of them are used as we call off-label, so still prescribed, but not a official indication for menopause. The caveat with paroxetine, or the reason we wouldn't prescribe it, is if you're on tamoxifen, which is pretty rare. So this is usually the first line non-hormonal medication to start. Some of the other antidepressants like venlafaxine, desvenlafaxine, citalopram, and escitalopram are also options. And the benefit with these is that you get some mood improvement, and you can also start at a low dose and increase up kind of based on symptom relief. Gabapentin is another medication that is used a lot in nerve pain or people with chronic pain, and can help with some of the hot flashes and other symptoms that people experience. Clonidine is also something that is helpful with those symptoms, and used by people who don't want to do antidepressants or hormones.
Sorry, doctor, what is tamoxifen used for?
It's used when people have had breast cancer before,
Okay.
and it's sort of a hormonal medication that they will continue long after their breast cancer treatment. So it's really specific for that situation.
Thank you.
And I will say that actually Dr. Dunsmore Sue, who made a lot of these slides, and this is her area of expertise, recently gave a presentation, and she actually is a breast cancer survivor, and her medical opinion is that a lot of the benefits outweigh the risks, and that even people who have breast cancer should talk to their doctors about whether there's a safe option or a lower dose, like a patch, because not only is it very safe, but also and maybe okay in a certain kind of cancer, but also just recognizing that some people go for 10, 15 years with these symptoms, and it really affects their quality of life. And so people may choose to, take a tiny increase in one area in order to like feel better.
Is the biggest fear like blood clots is the main concern with these medications?
It depends. So yes, probably blood clots is the most kind of common risk. And in lots of different situations, like when people have had a stroke before, that risk benefit decision might change. So I guess history of stroke or blood clot before is one sort of more common situation, and then a history of breast cancer or the likelihood that someone might develop breast cancer. That being said, like 1 in 8 women in the US get breast cancer over the course of their life, and it is not a hard and fast reason that we will not treat someone's menopause with hormonal medications. So it's really nuanced, and this discussion is so complicated. And when we talk to patients about this, they're often leaving with their head scratching, and it's really complicated and a really hard decision, and it's going to be different for every single person. And so it's something that every person needs to talk about with their doctor.
That's right. Thank you for the clarification.
Okay.
So there are non-hormonal and non-prescription medications that can be used to help with symptoms of menopause. We know that research on some of the supplements that exist is not as well funded, and that's part of the reason why there may not be as clear data. So a lot of these have some studies that have shown they've been helpful, and other larger studies that may have shown that they don't have a significant benefit. But even symptomatically, a lot of people find benefit from some of these. So the first one is black cohosh. There's also St. John's wort, which has a lot of different uses, and then phytoestrogens. And there are also supplements like melatonin to address difficulty sleeping. There are other botanicals that people use. And then just knowing that supplements are not approved by the FDA, or they're not regulated. And so even if you're getting one supplement may be completely different from another supplement, and it's really hard to know how much of a certain extract is in that supplement. And some of these studies have only researched specific brands, probably because they were funded by that company, which doesn't necessarily mean that other ones don't work, but it's just the only one that we can recommend safely. So black cohosh is probably the most talked about one that people use. It comes from a wildflower that's native to Eastern North America. And historically it's been used like for many, many, many years for menopause, for inducing labor, for PMS, and then for pain associated with periods. Several studies have demonstrated that it can help with menopause symptoms and the frequency of hot flashes. And the kind of most convincing evidence were studies that looked at only this specific medicine. And so there are, as you can see above, like Nature's Way, there's a lot of different ways that you can get black gouache at the store or in nature, but this remifemin is the one that was actually studied. It was that dosage and that exact formulation. The next one is St. John's wort. This is a really common one as well. It's used for a million different things. A lot of people use it for depression, actually. One thing to know about it is that it basically is processed by an enzyme in the liver that also processes a lot of other medications. And so it has a lot of interactions with many medications. And so especially with this, but definitely with all supplements, when a doctor says, or someone asks you when you come into the hospital, like what medicines are you taking, it's really important to tell them. Because for instance, it can actually be dangerous to take this along with an antidepressant prescribed by a doctor that's not over the counter. But as long as you're not on any other medications and you've cleared it with your doctor, it is very safe. And it has even shown to have some benefits with psychological symptoms associated with menopause, with quality of life, and with the hot flashes. And then phytoestrogens are like estrogen compounds found in soy products. And the research on this has mainly shown that it can be helpful in some studies, helping with the vasomotor or like sweating symptoms of menopause. This down here is, you realize it says strong placebo effect noted. And that just means that it's kind of like if someone doesn't know that they're taking that medicine, like they may be given a sugar pill or they may be given the medicine and not told which one they were taking. They found that the people that took the one that didn't actually have the medicine also felt better, which, it's safe. So I think if even if it makes you feel better and we don't know scientifically that it helps with those actual like physiological processes, there's a role for that kind of medicine. Yeah, this is kind of what we talked about before. It's just that there are some especially medication interactions with these medicines, and so it's important to talk to the doctor. And then St. John's wort is like it actually acts on the serotonin system in your brain, and so especially if you have a history of like mental health disorders, it's important to talk to your doctor. Other things that have been shown in various studies, but there's not as strong evidence, are rhubarb, royal jelly, which I actually have no idea what that is. I'm sorry. But sage, and then
Dong Quai, so there's a few small trials that study Dong Quai, evening primrose, vitamin E, and then red clover is another one. And those studies show that it was ineffective for hot flashes. So people who took the medicine and didn't take the medicine kind of had the same symptoms statistically. But like Claire just said, like that being said, like some people still do find benefit from these things, and they're generally safe and worth trying if that's something that you're interested in. I think that kind of is like my thinking about any supplement, is that as long as it's not causing harm, it may help, it may not help, but can be worth a try if someone is trying to avoid prescription medications.
And then I think another area where there's not enough research is nutrition, and this kind of goes to show that there are lots of foods and just like eating a varied diet with fruits and vegetables and herbs probably has lots of benefit. Okay. So behavioral modifications, there is evidence that weight loss can help with the symptoms of menopause. I think a lot to do with the like vasomotor or sweating symptoms. Exercise, it helps with sleep, it helps with mood, it helps with those sweating symptoms. Modifying your environment as much as you can. So keeping, cold iced drink by your bedside and at your desk, wearing loose clothing or layered clothing so you can take something off. Quitting smoking if that's something that you're still doing. And then with most things in life, avoiding alcohol, really spicy foods if that triggers for you, caffeine, and then drinking water. Here's another slide about, and then the exercise is also really important for protecting your bone health as our bones start to deteriorate as we get older. And actually the exercise that helps the most with bone health is like resistance training or with weights. And so while it's really good to walk, and that can also help with other symptoms, having some sort of like class that you go to or like YouTube video with bands or weights is really helpful. This is about diet and menopause. As you can see, the foods to eat during menopause is kind of based on the ones that we talked about. So like beans and legumes, soy products we talked about, and then generally food rich in vitamin D and calcium, and those are both recommended for bone health. And then whole grains, and then foods to avoid are anything like stimulants like coffee or alcohol, and then lots of like sweets, because that can make your symptoms worse, and spicy food sometimes make people feel hotter.
And the caffeine and the alcohol and spicy foods are also what we call bladder irritants. And bladder irritation and dehydration, those are things that can contribute to that vaginal dryness symptom that's really, really common. And so that's kind of a thought behind that.
And I think one thing that we didn't talk about as like non-hormonal methods is just like in general, like vaginal lubricants.
There's a slide on that.
Oh, there's a slide on that. Okay. Yeah, so other integrative methods, there is actually good data for cognitive behavioral therapy, which is a kind of behavioral therapy that a lot of psychologists and therapists at like any health center are trained in actually, that can help with like breathing techniques, and things that you can do behaviorally to help with your symptoms. And then there's biofeedback and relaxation techniques. Acupuncture can help some people, and then hypnosis. For insomnia, there is good evidence for melatonin. Oftentimes at the store, the melatonin doses are really high, but generally the dose is like 1 to 3 milligrams actually. Valerian root can make people really sleepy. Other people use magnesium tryptophans, which is like an ingredient that kind of you find in turkey and in like warmed milk, that can make you sleepy. Hops and these other supplements, glycine and 5-HTP. The next slide I'll go through quickly is on sexual changes. So vaginal dryness is a really big problem for a lot of people. Even people who aren't in menopause, there are lots of different moisturizers that you can use that can make there be less discomfort and increased pleasure associated with sex, and just every day. So you can use coconut oil, kind of anything without like a scent really is okay. And then just knowing that certain like kinds of lubricants, if you're also using condoms, you should not use like an oil-based lubricant with a condom, because it can increase the chance that it can break. And then there's also like vibrators and like books and different kinds of techniques that you can use to increase your satisfaction with your partner. Yeah.
The last thing I'll say, that I had a mentor in medical school that always said this to their patients, and that you can think of your kind of sexual organs as she called it use it or lose it organ. And so continuing to have regular sexual activity will actually kind of ward off a lot of this sort of dryness and sort of, I don't know, it's called atrophy in medicine. So the tissues like over time do actually kind of die and lose a lot of their function. And so the more you have sex, the more you'll kind of ward that off and keep your sexual function intact and good.
Vaseline is totally okay. That's great. Anything like that, or like Aquaphor. Yeah. That's probably better than coconut oil, honestly, because there's like no scent.
Yeah. Do you want to take it on? I'll do it. Okay. This is our second to last slide. Just some take-home points on summarizing what we all talked about. So menopause, in summary, is a very normal part of life in everyone with ovaries. And for some people, the symptoms, including hot flashes, cognitive changes, mood changes, sexual changes, can be very debilitating and really impact quality of life. Hormone therapy is beneficial and is safe when it's started within the first 10 years of menopause. Estrogen is the most effective treatment available to treat hot flashes and needs to be taken with a progesterone to protect the uterus from endometrial cancer. And so if you don't have a uterus anymore, that's not relevant, and you can just take estrogen. And then there's also many non-hormonal options, including lifestyle changes, medications, therapies, and other techniques, as well as supplements that can help. And not all supplements are safe, especially when you're taking other medications. So just talk to your doctor if you have questions about supplements. And then finally, two reliable resources that we like to use. The North American Menopause Society is a professional society, mostly of physicians, and they have lots of great resources on their website that are really accessible for any sort of healthcare provider and also to patients. And there's lots of FAQs and glossary of terms and good summaries of all the research studies that we have used to make these slides. NatMed is another database online that unfortunately we just discovered is behind a paywall, and so is not accessible to everyone. And if anyone ever needs any information on, and that's basically a database of supplements and kind of what evidence is available for their safety and for their efficacy. And I think any of us would always be happy to help look something up for you. If Zainab ever wants to connect anyone to us, we would be happy to help use NatMed if you can't get access to it. And that's it. And we want to take all of your questions that you may have about menopause. Thanks for listening.
Thank you for a great presentation, doctors. Learned a few things, and I have some questions of my own and just some comments. But first, just open the floor to anyone who has a question or a comment. Thank you. Yeah, I think some of us found that the reason why men, or why the medical community thinks men are more susceptible to heart attacks than women, like the estrogen levels and stuff like that. That was something new that I learned. Let me see. Okay, I will go ahead and ask a question. I was wondering, doctors, if you can speak to like the social aspect of menopause. I know like it doesn't really in our culture, not a lot of people talk about menopause. It's kind of like there's that stigma attached to it. Just wondering how one's social circle kind of can help with the symptoms or the journey of menopause.
Yeah, that's a really good question, and I'm curious if anyone else who's listening has any suggestions, just because I think like anything, having community can help. And it's also one of those things where you're right, people don't always talk about, but everyone goes through. And so I think I would just recommend like kind of recognizing that a lot of these symptoms could be from menopause and having those conversations to get support. But does anyone else have experience, like who maybe has gone through menopause or known someone who has found support through the community?
Yeah, just leading up to our session, I was doing some reading and just the how important it is to talk to one's mom or like when she had menopause, and just kind of answer some of those questions that give people anxiety about entering menopause, or just what to expect. So, and talking to other women who may be in the same boat as you, kind of building that sisterhood and that knowledge and learning together and just sharing. I'm assuming it would help the psychological aspect of that.
Yeah, I always ask people if they know when their like mom went through menopause, because it can be a predictor.
I think it's also something that people can be nervous to bring up with their doctors, and it's something that I think we try our best to always ask folks about when they're around this age. But when people have lots of other medical issues to talk about during their visit, I think fall to the wayside, but I would really encourage you all to bring it up with your doctor, even if you haven't even started menopause, but you have questions about it. We do love talking about it, and it's something that we find really important, and find that a lot of our patients, like you're saying, there's a lot of stigma associated with it, and have a lot of shame associated with having menopause, which is sort of not great and not good. And I think the more we talk about it, the less over time that will happen.
And people also may have symptoms for years before even their periods change, and so and we do miss asking about, specifically vaginal dryness or mood changes, and so
That's right.
never a long time to bring it up.
Yeah. And so I think what I heard you say is like the distinction between perimenopause and menopause is the fact that your period won't, like 12 consecutive months, you won't get a period with menopause, whereas perimenopause, you're still getting a period, but it's just like not as much.
Exactly. And you can start having all those menopausal symptoms, like all the hot flashes and cognitive changes, before you've actually technically hit menopause. So perimenopause is a time period where you can still have all of those symptoms. You just haven't technically had 12 months without a period yet.
Got it. Okay. And there's the misconception like you can't get pregnant when you're on menopause. So is that also one of the things that that's out there?
You
Yeah,
can definitely get pregnant in those perimenopausal years. Yeah.
Okay.
The definition, however, of menopause is that you're no longer fertile once you are menopausal. So once you have hit menopause and have gone 12 months without a period, you should not be able to get pregnant. But anytime leading up to that, you can still get pregnant.
You can still get pregnant. Got it. Yeah, I was just wondering how menopause and perimenopause affects women of color differently than white women.
Oh, that's
The symptoms are the same.
That's a great
I don't
question,
know.
and I don't think we have like the data or studies to know if symptoms are different, but I'm sure that there is data that we're under treating people of color, women of color who have symptoms, and perhaps not asking or not offering treatment to them also. So hopefully, like by opening up discussions more, we can increase access and increase the amount of people who have relief from their menopausal symptoms.
That's right. Yeah, thank you. Yeah, I'd be also curious to know like how other cultures, other women outside the US like fare with menopause and what they're using and how they deal with menopause. So that's interesting. I think I'll look that up because as you were talking, I was like, oh, with the herbs and stuff.
Yeah.
Yeah.
Mm-hmm.
Yeah, we would love to, if you learn anything, we would love to know.
Mm-hmm.
Absolutely. Yeah, I will share that. And I will also, anyone who wants the slides from the presentation today, I will be more than happy to pass that on as well. Just drop that link in here as well. Yeah. Right. If there aren't any more questions for our doctors, then I will let them go and we will see them next time.
Thank you so much for everyone for listening. And if you have any questions after the session, please email Zainab and she can pass those on to us and we're happy to get back to you.
Absolutely. And thank you again, doctors. It's nice to see you again. I totally forgot that some of you were at the movie screening. Thank you for coming through that night. It just made the whole night so much more special. We really enjoyed having you. And thank you for coming today as well.
Thanks so much for having us.
Absolutely. Yeah, well, I will let you guys go. And thank you everyone for being here today as well. We will see you next time and enjoy the rest of your evening.
Bye.
Bye, guys. Bye.